This reconstructed film of soldiers with shell shock receiving treatment at the Royal Victoria Hospital in Craigleith, Edinburgh, was originally made in 1918 by Dr Hamilton Marr. It was funded by the Medical Research Council and shot by cameramen from Pathé News, filmmakers and film distributors in London. Original nitrate film seems to have been lost. There are no copies in film archives. However, little sections of the film have survived as illustrations in a book published in 1919 by Oxford University Press and written by Dr Hamilton Marr. Because the reconstructed sequences of film are quite short, we've repeated them in the movie. However, everything you see is original footage, and we haven't used any digital techniques to reconstruct the film. Dr Hamilton Marr had a distinguished career as a psychiatrist in Scotland before the First World War. He'd been the superintendent of the Woodley Asylum in Lenzie, and then become medical commissioner of lunacy for the whole of Scotland. In 1916, shell shock spread through the British Army as increasing numbers of battles generated larger numbers of casualties. There was a need to treat these servicemen when they were invalided to the UK, and the War Office took over increasing numbers of hospitals throughout England, Wales and Scotland. In April 1916, Hamilton Marr was recalled to the UK to be consultant in nervous and mental disorders and took up his post in Edinburgh at the Royal Victoria Hospital. Marr, with the rank of Lieutenant Colonel, was given responsibility for the treatment of all cases of shell shock in Scotland. And at the end of the war, he estimated that as many as 18,000 psychologically wounded troops had passed through Scottish hospitals. The Royal Victoria Hospital had been opened in the grounds of Craigleith House in 1894 to treat patients suffering from consumption. The treatment regime, which consisted of lots of fresh air and rest combined with graduated exercise, determined the design and use of the hospital buildings, which were greatly extended between 1903 and 1907. 3 locations were used in the film: outside the administration block, beside one of the 5 butterfly plan pavilions used for patient accommodation, and in the tree-lined grounds of the hospital. Doctors were concerned by the number of shell-shocked patients who didn't seem to be getting better. As a result, the Medical Research Committee funded a programme to film the treatment of servicemen so that this could inform training and further research. Marr was not the only doctor who made one of these films. Arthur Hurst, down at Netley, was also involved. And like Hurst, it may be the case that he appears in the movie itself as the doctor in front of the administration block and demonstrating movement in one of the patients bears a strong resemblance to Marr himself. We know that the Medical Research Committee commissioned a series of films to investigate the nature of shell shock, but until now only one has survived, that by Arthur Hurst called War Neuroses. So the discovery or the recreation of the film by Marr is an important addition to the series. The creativity that he showed in making this film reflected the innovation and determination that he and others put into finding treatments for intractable or severe psychological illnesses during the First World War.